clear than the elbow, because the elbow one, I usually just get in there and I grind it around and I take it for granted, and I need to show you a bit more clear. So, no, this is fine. The valgus and the varus stress testing, you already know how to do this, and it's really, if you think it's MCL, so just get the athlete's leg, and I always hold the leg under here, because then I have a little bit of support. You can be comfortable, you don't have to do an ab crunch if you don't want to. And then you just push from the outside. So I'm pushing, I don't know if you can see that, but I can even feel that plate. That doesn't hurt, does it? No. I don't know what ACL is. Maybe we'll get a positive drawer test here. Okay, so that's a valgus deformity, right? And I'm testing for MCL. Just do the same thing on the other side. And if you hold that sort of leg underneath here and support it, then you can really do it this way. So I can really, it's actually got a nice little spongy end there. It just means it's strong and it's intact. If it wasn't, it would go really significantly. Okay, so you can kind of see what they may do is if you think it's the problem with doing the PCL at 0 degrees is or the ACL at 0 degrees is the problem with doing it perfectly straight is the PCL will kind of not contract, but it will stabilize the movement a little bit. So sometimes what they'll also do after they do valgus and varus is they'll take it off the table a little bit. So slide that way for me just a bit. Is they'll take it off the table and then just relax it, and then they'll do it out here. And that will take and you can even flex it a little bit to about 30 degrees, and then that will take the PCL stabilization right off it. And that's for both valgus and varus. And that's why I put that up there. Now the Lockman and the anterior drawer. The anterior drawer test is quite simple. You just actually have it flexed. So I'm at 45 degrees and I'm pulling it forward. But what's important is I keep my thumbs here so I can kind of feel the joint line a little bit. And I also want to feel the hamstrings. I want to make sure the hamstrings are relaxing, because if they're tight, they might actually contract and not allow you to pull the drawer open. So if I have an ACL injury, I'll get a shift here. Now recently they've said, and it's the last 12, 15 years, they've basically said, you know what, the Lockman test is better. The Lockman test is the same test, but you don't do it at 45 degrees, you do it straight. So you can lay down again, I'll do it this way. And it's the same thing. Yeah, there we go. It's the same thing, I've got it kind of straight, and I'm just sliding it forward. So you could do it this way, or you could simply do it this way, where you're actually feeling in that joint line to feel that shift and that translation. So the only difference you have to know about the anterior drawer is one's at 45 degrees, and the hips at 45 degrees, the knees at 90 degrees, but the Lockman test is straight. And so I'm doing the same test. I'm opening the drawer, but just doing it from a straight position. Posterior drawer is the same thing. I'm just closing the drawer. So you can do posterior right after the anterior drawer. So you basically, you're pulling it out. So if I'm doing it at 90 degrees here with the hip, I pull it out, making sure that the hamstrings are relaxed, and then I'm pushing it back, and I should feel that translation. You could also do the posterior sag test for PCL, and that's literally, if I hold his toe up like this in the air, if his PCL is messed up, it will just literally slide back. It won't even stay intact. So I'm holding it up here, and it's sliding backwards. It's called the posterior sag. So you can do those ones in conjunction with each other. Patellar apprehension, because the patella dislocates laterally, I can literally take it and slide it out here with my fingers, right? If it was a dislocating one, it would keep going. I wouldn't get that contraction to keep it in. It would just keep going. I don't know if you guys can see that one, but you just get in there and you play with the patella a little bit. Applies compression, so I'll get you over onto your tummy. Applies compression is really, if you think there's cartilage, so we've been looking at ligaments and a patellar dislocation. Now we're going to look and see if his cartilage is sensitive. And if I press down here and I grind it up, right, he's going to be really in a lot of pain if it's cartilage damage. So it's just literally I'm grinding it in there. And I can even sort of bend it over to the side if I want to do lateral or medial compression on it, the grind test. And then the distraction is basically pulling it away this way. And I'm still testing the ligaments, the cartilage, but I'm seeing if the ligaments are pulling away from the cartilage, right? This way, and then if you've done the ACL and the MCL, right, the ACL would be pulling the cartilage away. He can flip, and that would be painful, right? So Apley's compression is the grind test. Distraction is lifting up. You put your hand on the hamstring, and you lift up, and you twist. The McMurray test is meant to isolate the meniscal side even further. So once I've done my sort of anterior drawer and my Lockmans, And then I can do a distraction and pressure test, compression test. Then I can check for McMurray. Now, what the McMurray does is it's literally like, you can lay back on this one. I would get people to lay back, but slide your bum up this way. And it's the same thing where what I might do is I might just rotate it, and I might grind at the same time. So I'm grinding this way, and then I'm rotating and grinding it that way. And I should be able to feel in there if there's any action. And you can feel it, you can hear it, and you can watch the pain on the face, right? So if you want to go a medial, you could even put a bit of medial pressure and then grind it. And then you can, like valgus or varus, and then you can just feel that pressure in there. And that's your body position for that. And I tried to indicate up here sort of what you're testing. So like external rotation with valgus will indicate the medial meniscus, and so on and so forth. Okay, so those are the ones you need to know. The valgus and varus, so just pressure inside or outside. Think about what you're testing for. It should fit. You'll pick the test to fit the mechanism. So if they say, oh, it really hurts on the inside, and then you do your medial pressure test, then it kind of rules rules it in, right? It's a positive test if that's painful. Don't be afraid of doing a thorough assessment. So it doesn't hurt to run through all the tests for a knee injury just to make sure. But once you've determined it's an MCL, you might want to take it further and check the meniscus and then check this side as well. Lockman test is considered to be a better test, but anterior jaw is most commonly used. The key is to use your hands so you can feel the joint lines, you can feel the translation, and you can use the back of the knee to feel for the quad, the hamstring contraction. And if they're kind of fighting you, then you may not get a positive test. For the posterior drawer, you could also do a posterior sag test. So I close the door, or if I really am thinking it's posterior cruciate, then I hold the toes up and see if the whole thing sags. For patellar apprehension, I'm checking patellar dislocation. For applique compression, I'm checking for meniscus. For distraction, I'm checking meniscus, but I'm also seeing if the ligament, if I thought it was a ligament, then maybe it was where that ligament went in, and now I'm trying to distract the cartilage up with it when I'm testing it. And the McMurray test is okay, you figured out it's meniscus, which side is it? And sometimes you can combine those tests. Okay, give them a try.